The first thing that we saw was that the cancers that are occurring in young adults bridge between those seen in children and adolescents and those seen at older ages. So, for example, in children, we see a lot of leukemias and brain cancers, and we do see these in the younger age groups of young adults. But we also see the cancers that are more common in older ages, like breast cancer and colorectal cancer. The second thing that we observed was that there is a lot more cancers occurring in women, and this is because we saw quite a lot of breast and cervical cancer. And the final thing that we observed was that there was a huge heterogeneity in the cancer burden worldwide, and that was both in terms of number of cancers occurring, number of deaths occurring, but also what types of cancers were occurring in the different regions. So when we looked at the types of cancers occurring, we saw that there was a greater burden of cervical cancer and liver cancer occurring worldwide. And these are two cancers that are largely preventable. So based upon our results, we can see if there were national human papillomavirus programs and national hepatitis B virus programs, we could greatly reduce the number of cancers occurring and the number of deaths worldwide in young adults. So the first thing that's definitely needed is increased awareness. Compared to cancer research occurring in children and older age groups, this group is definitely a bit left behind, both in terms of research and in regards to policymakers. So we need to increase awareness about that cancers are occurring in young adults aged 20 to 39-year-olds, and so that these people are more aware of the risk factors of what the signs are of cancer, so that they can, get vaccinated, so they decrease their likelihood of having the cancer in general, but also pick up the signs so that they can be treated and diagnosed more timely. The other thing is that treatment for young adults is a bit uncertain still at the moment, and that's because often we extrapolate what treatment they should be getting based upon whether they're from children or from older ages. So we need to increase the knowledge of what protocols work best in this age group, and that will be through enrolling them more in clinical trials and doing more risk stratification. So in general, I would say what is really needed is that we need to take what we learned from our research in children and older ages and really apply it to this group. That is, improve the treatment protocols and definitely increase prevention and treatment for these individuals so that we can decrease the cancer burden and improve survival outcomes.